How to run the perfect facial aesthetics consultation. The perfect consultation allows you to understand the patient's wishes and demands and enables you to increase patient satisfaction by delivering the results that they want. Tip number 1, allow enough time. What I find novice practitioners do, they rush the consultation only allowing 5 or 10 minutes because maybe you're not getting paid for it. But the value and the time invested in this will outweigh any monetary value because you'll have time to listen to the patient's concerns, deliver outstanding results, and have a long-term patient that keeps on coming back. Tip number 2, what questions should you be asking during the consultation? As well as normal medical history, general health questions, there'll be specific questions related to the procedure. The first one I always ask is, what are they hoping to achieve? Is it realistic? Can I deliver the results that they want? Number 2, do they have a time frame in mind? Because we don't want to be rushed for treatments. As we know, certain procedures will take longer to deliver the results. Number 3, have they had it done before? If they have, why have they changed? Because I do not want to repeat the same mistake the last practitioner made. With dermal fillers, there's an extra question we would ask, and that question would be, are you allergic to bee or wasp stings? Because if they are, they cannot have the reversing agent and we will not treat them for dermal filler. So the standard questions we would ask both toxin and filler patients, and one extra one for dermal filler patients. Tip number 3, always allow a cooling off period. Never be pressurized by the patient to deliver the results or undertake the procedure at the same time of the consultation. I make sure all my patients are given a cooling off period. We will not treat them within 24 hours of the consultation, and I'll make sure I record that entry in the notes, give them time to think about it. They may have extra questions after reflection period. So allow a cooling off period, never ever treat within 24 hours. Tip number 4, which has made the most impact in my consultation, is working out the behavior type. Broadly speaking, patients will fall into 3 behavior types: visual, auditory, kinesthetic. So let's have a look at 2 parts. 1, how to find out what behavioral part they are, and 2, how you can use that to your advantage when you present the treatment. So how do you work out what treatment type they are? Visual person will talk very fast, very quick, very loud, and have exaggerated hand movements. Normally they would have quite colourful clothes. Auditory will talk a bit slower, a bit quieter, less exaggerated hand movements. Kinesthetic will talk very slowly, very quietly, prolonged pauses, and there will be less colourful in clothes. Also, you can look at the vocabulary they're using. Visual persons talk about, can you see those lines? Can you see that fold? Auditory will say, do you hear me? Does that sound okay to you? Kinesthetic will talk about emotions, feelings. They're lacking self-esteem, they're lacking self-confidence. Once you've established what behaviour type they are, then you'd present your treatment plan. So for a visual person, they would decide on visual images. So you want to show them loads of before and after pictures. Auditory person will love facts and figures. So you want a fact sheet talking about injection sites, how many units you would give, how many injections you would give, how long the treatment would last, how many sessions they would need to get the desired result. Kinesthetic love case studies. How did your treatment or procedure transform someone else's lives? So you're looking at video testimonials and case studies. One word of warning, you will be one behavior type yourself. So if you're visual, you expect everyone else to be visual. And let's say you're talking to an auditory or kinesthetic person, you're going to turn them off and you're going to be talking about or showing them before and after images. And if they're audio kinesthetic, they're not going to be interested in that. So as well as being wary of the patient's behavior pattern, be wary of what your behavior pattern is. These are the strategies we use during our perfect patient consultation, and I hope you found them useful. To explore this further, please download our free guide in the links below in the description. In the meantime, please like this video, subscribe to our channel, and I'll see you soon.